Oh, nag-glitch siya. Oh,
Na-display.
nakikita na. Okay na. Pa Papandok pa buat pa-zoom out kay direya buat naka-complete.
Teka.
Ito na, okay na. Good morning, Doc. We are from the Pediatric Group 12 and Subgroup 1. We are composed of Aliposa, Obani, and Ormeneta. So today we will be discussing our first patient in our second semester. Patient KS was examined on February 2, 2023 at 10 a.m. She was admitted on January 27, 2023. Mother was the primary historian and is 90% reliable. Patient KS is a 3-month-old female born on October 7, 2022, Filipino, residing in Barangay 105 Suhi, Tacloban City, and was admitted for the first time on January 27, 2023 at EVMC Bagakay, Tacloban City. For our chief complaint, seizure po. For our history of present illness, first day prior to admission, the patient had an episode of seizure for about 15 minutes as verbalized by the mother. Before the episode of seizure, the patient was just lying down and playing on her own. During the seizure, the patient experienced stiffness and uncontrollable jerky movements of both upper and lower extremities, eyes rolled upwards, and no jowling was noted. After every seizure, the patient seems to be normal again as verbalized by the mother. The patient has no associated symptoms such as cough, fever, diarrhea, and did not experience difficulty of breathing. No medication was given and no consultation was done. On the day of admission, the patient had another episode of seizure for about 15 minutes as estimated by the mother. During the seizure, same lang po ang mga senaryo nga nahinabo. By this time, the patient already experienced a fever of 39 degrees Celsius, which prompted the mother to seek medical help and brought the patient to EVMC. During consultation, the doctor noticed that the patient had another episode of seizure with undocumented duration and immediately referred the patient to be admitted. For our past medical history, our patient had immunization of pentavalent OPV, PCV on January 18, 2022. She has known food and drug allergy. The blood type is ORH positive and no history of blood transfusion. She also had no surgical history. For the birth and maternal history, patient has no discoloration with good and strong cry, no dyspnea and no convulsion and no hemorrhage. For a birth history, patient was delivered full term, 39 weeks AOG via cesarean section and assisted by an obstetrician at EVMC. For the prenatal history, patient was born to a healthy mother at the age of 32, G5, P5 who did not smoke, who did not use any drugs or had any alcoholic beverages during pregnancy. No history of any congenital diseases, no bleeding, no abortion, and no pain. She had prenatal consultation during her first to 9 months AOG at EVMC in Tacloban City and received complete immunization. For the nutritional, for the feeding history of our patient was exclusively breastfed from birth up to the present, done every 2 hours with duration of 15 minutes on each breast. For immunization history, since our patient is just 3 months old, di rin pa complete niya vaccine. So in present, may daniya at birth, may daniya BCG and Hep B vaccine at 6th week or the 56 days. Recently lang turo kaniyahin pentavalent, OPV and PCV vaccines. For the growth and development, for the gross motor, patient can move legs and arms off surface when excited. Then fine motor can open and closes her hand by her own. And for the language, since 3 months old pala, nag-mimic pala yan mga cooing sounds. For the family history, patient's father is a 35-year-old worked at the pier as an operator with no known medical condition. For her mother, 32 years old, a housewife with no known medical condition. No known hereditary diseases on paternal side, but asthma is the only known hereditary disease on the maternal side. For her siblings, may dani-apat ka siblings. First, as deceased due to complication at home birth. Second is a 15-year-old male, apparently well. Third is 10th 10 years old female, apparently well. And fourth sibling is a 4-year-old male, apparently well. And he and ika-fifth, currently admitted. For the social and personal history, patient is currently living in Suhi, Tacloban City in a well-ventilated bungalow house with 6 other members of the family. They don't have pets at home, but mosquitoes, flies, and rats are seen in the surrounding. Their toilet is a manual flushing type located inside the house. They go as their electric provider. Garbage is collected weekly by the city government dump trucks. Their source of potable drinking water is purchased mineral water ha mga sari-sari store. And Jetmatic pump, or in our layman's term, bomba, is used for washing dishes, cooking, and taking a bath. They cook inside the house using butane and store their leftover food just in their dining table. The father is the main provider of the family. The mother is the one who cooks and buys food. The patient typically goes to bed for her sleeping pattern. The patient typically goes to bed right after feeding and wakes up every day at 4 a.m. according to the mother. She typically naps and plays by herself during the day. For the risk factors during our interview, we we nagtakol kami duha, which is the low socioeconomic status, and father is smoking inside the house.
So before we proceed, let's go back to your history.
HPA. Okay po.
Okay. So let's go first. So go back to the general data. So if we are confronted with children, di ba? If we say it by months, the less than 1 month, an aton age is by days. Pag 3 months na nga ni baby, dapat may dakita pero kahit mo sobrang days.
Okay po, Doc.
3 months and para ka days. So kompleto kita ha. So 11
Okay po,
over
Doc.
30 if that is the case. If years old na nga niya, so 5 years old, kumpara ka months na 5 over 12. Kung months siya. Kung years na siya. So in your case, 3 months. So what is your chief complaint?
Seizure po.
Seizure. So let's go to your history. So apparently well animo baby. So you can start, the patient was apparently well until patient had history of, meaning the patient had no previous symptoms, no cough, no fever. So pwede ka ito magbutang. So kaya sudden onset man lahiya, di ba? So patient was apparently well until one day prior to admission, the patient had episode of seizure. So that's the time that you will be characterizing the quality, the duration of the seizure, and importantly, after the seizure, what was the post-ictal ba? After what happened to the seizure? Did the patient return back to, ano ini, girl or boy ba ini? Nangalimot ako.
Girl po.
Oh, turn back to her previous activities or parang still with good feeding? So, ganito. Sige. After that, on the day of the mission, so usually kasi if you have consultants, especially kung medyo old din at yung consultant, it is by hours. So, not on the day of admission. Pwede
Okay
kita
po.
5 hours prior to admission. So, particular kasi ito. In pediatrics kasi medyo makuti kita. Oo. Makuti talaga tira. So, kung makakuha ka mo, How, at what hour did the recurrence of seizures start? So, so patient had recurrence of seizure 5 hours, so 5 hours prior to admission. You could have stated that. So patient had another recurrence of a seizure characterized as so ganini with the dapat characteristic ang seizure, duration of the seizure. Di ba may dagay tayo pag-characterize ito ni mo seizure?
Clonic, generalized, and
Oo,
food.
kuan, ano ito? So, tapos, so nag-fever na siya during that time.
Yes po.
So, when the patient had consult again at the, so during consultation, how many hours did, so that's the importance that you have the hours, ha?
Okay
Kasi
po.
kikita ko natin kung an interval ba. So, kung bangin nag 12 hours anay. So, kay if you look at this case, kung babasahon lang natin, parang nagdiretso dayon niya. Seizure, tas consult niya dayon. So, kailangan mag-pocket an hours, ha?
Okay po.
Tapos, so during the time when they had consultation, were there fever? So, gadbahag
Yes
to?
po.
Oo, so during consultation, the patient still with fever noted to have another episode of seizure. So the doctor kuan advise admission. So ganyan yan ha. So
Okay po,
very
Doc.
particular. So important ito particular kitang age and mga tapos yan kanan aton hours and imo HPI. Especially kay ini mo case is acute. Kay
Yes, Doc.
kung medyo maihangan ni amo ito nga by months, by weeks. Pero kung it imo patient 3 days la 2 days, so dapat 2 days tas by hour kita aton pag hatag it HPI. So okay. So exclusive breastfeeding ba ini?
Yes, Doc. From
Okay.
birth up till the present.
Normal man aniya newborn screening. Nag-ask
Yes po.
ka about newborn
Yes po.
screening.
Yes po. No complications man po, Doc, during birth daw.
So they know the result of the newborn screening.
An amon lang na pakiana, Doc, about newborn, tas waray kami nakag-specify about that po.
Oo. So, important yan, especially now na that we have newborn screening. So, especially yung mga sugad pa rin, yung mga infants or neonate, important ito ni newborn screening. Tas, in the family, are there any history of seizure or febrile seizure?
Waray po, paternal nga maternal side. Pati niya mga siblings po, Doc, apparently well nga tanan.
Okay. So you can put there one dose of pentavalent o PCV. One dose pala, di ba?
Yes, Doc.
Sige, let's proceed. How many days did the patient stayed at emergency after delivery?
Waray naon ka-ask, Doc.
Were there any medications? Sugad ito. Maray ni. So, important ihapon kita, ha?
Okay, Doc, noted po.
Tapos, so let's proceed. Prenatal. Okay. Sige pa. Nutritional. Exclusive.
Yes, Doc.
Sige. Sige, let's go to your physical exam.
For the physical examination, general survey, the patient was examined in a lying position, appears to be drowsy and not in cardiorespiratory distress. She sometimes wake up and go back to sleep again for a couple of seconds. She is a febrile, nourished, well developed with the following vital signs of Doc, and blood pressure waray po kami nakakuha since anamon dara kay pan adult na BP po. So for the temperature, it is 37 degrees Celsius. For the pulse rate, it's 110 beats per minute, and respiratory rate of 24 cycle per minute. Then right side po is the ideal values. So for our anthropometric measurements, for her head circumference, it's 40 centimeters. For the chest circumference, it's 40 centimeters as well. For the abdominal circumference, it's 42 centimeters. And for the muwak, it's 13 centimeters. For her length and height, it's 55 centimeters, and her weight is 5.2 kilograms. For our for
Before we proceed, can you describe to me the anterior fontanelle? Can you describe the anterior fontanelle? Okay la ba open lahiyan, nakabutang? Especially if you are dealing with a patient with seizure. Is it bulging, non-bulging? It's very important if you have patients with seizure, ha? So when is the best way to kapa with the anterior fontanelle? So what would be the position of your baby? Nakasupine, tapos dapat at least elevated ang imong head, ha? Tapos you have to check for the fontanelle. Tapos upod na gihapon na imong mga sutures. So open, is it bulging or non-bulging? What is the shape of your anterior fontanelle? So these are physical examination na medyo magbubusisi kita if we are dealing with certain diseases kasi we will not be asking iton iba nga mga physical exam. So can you describe to me what is the best way in doing physical exam for your anterior, for your fontanelles? Anyone? So, ano yung baby? Is your baby calm or crying? Oo. Your baby should be calm or better yet if the baby is sleeping. Ha? So, medyo elevate mo ito tiya head, tapos you check. Start di ayo di likod. Ato bang kadini kaya himatim anterior fontanelle. You check the size and the shape. Kay iton ibaluwa, pwede dakot imo shape, size iton imo fontanelle. Because going to your suture line, tika diha imo posterior fontanelle. So when do you expect the closure of your anterior fontanelle? Sige daw, si Dr. Aba Rosida. When is the closure of your anterior fontanelle?
Ano daw,
When do you expect?
within the first 2 months daw.
Ano? Are you sure?
Posterior frontal daw, di ba?
Anterior, tapos anterior. 10
Anterior
months
daw,
daw.
mga 18 months, sorry.
So 9 months to 18 months na
Yes
start
po.
close.
Opo,
So your
opo.
posterior fontanelle,
Posterior daw is 2 months, within 2 months po.
so are there anyone who would like to add more? Okay, Doctora, let's proceed. Kanin mo PE. Your PMI, are you sure about that? When do you expect your PMI to be at the 5th ICS? Are you sure about your PMI? When do you expect your PMI to be at the 5th ICS? Let's go
When the patient reach adolescence po, Doc.
adolescent. So na to? Si Dr. Mark Kevin. So at what age?
Kuan Doc. Usually in the fifth
Pardon?
Dodo,
Hello? Sige. At what age?
mga kwando, mga 4 to 8,
4 to 5 years old.
4 to 5
Yeah,
years
so
old.
mga fifth ICS na. So your baby is just 3 months, so you expect it to be at the fourth ICS pa lang, not unless if you are confronted with infant with congenital heart disease. Okay, so always important to know your normal, and if you think that an IMO patient is abnormal, you have to recheck again. Okay? Sige. Let's proceed. So what is missing in your neurologic exam? Since you are dealing with an infant, ano pa dapat ito imo added dito imo neurologic exam? Anyone? I will be calling once again si Dr. Aliposa. It's already on the tip of your tongue. It just kind of, it's already there. Sige daw. Very important. Kaya hindi mo baby kuan. Nag-seizure.
Babinski.
What do you call that? Ano mo?
Lexus.
Diri la babinskit ko lang.
Reflexes, Doc.
Your primitive reflexes.
Reflexes.
Know when will it appear and when will it disappear. Ha? Okay, there are primitive reflexes that will appear during the 5th month. There are primitive reflexes that will disappear during the 2nd month. So, dapat memorize gyapon ito niyo. Ha? Okay, so especially for this group, age group, not we will not be asking for the primitive reflexes for the toddler or the older children, just only for the infants and the neonates. It's very important also, huh? So memorize. So remember, memorize when will it disappear, when will it appear and when will it disappear, and what is the primitive reflex that will persist throughout life. So may dayan. Okay, let's proceed to your discussion.
And we'll proceed, Doc, for the discussion and salient feature for the demographic profile. We have 3-month-old female Filipino. For the HPI, we have seizure and fever. And the PE findings, we have positive for the nuclear rigidity and positive for the Brzezinski sign. And the patient is drowsy. For the differential diagnosis, we have we opt for the encephalitis. We ruled in this for positive for seizure and fever and positive for nuchal rigidity.
Your pivot, doctor. So do you have a pivot,
Seizure,
fever,
seizure,
and
fever
seizure?
and seizure.
So your fever and seizure, you can put it there. Puro sira infectious diseases, ano? Ano mo
Yes.
epilepsy, di rin man niya infectious. So pwede kaya non-infectious and infectious. For non-infectious, amo ka may seizure ka, kami ni nga imong epilepsy. You ruled it out, why?
We cannot totally rule out because it needs further laboratory workup. No.
Okay, sige. Pero
And
kung based on
second,
physical examination, you cannot rule out also.
for the encephalitis, though, we cannot pa. We kailangan pa laboratory.
So,
Because we have only the fever and seizure.
mhm. Did you consider complex febrile seizure?
Wala po, Doc. Consider lang sepsis.
Kasi in children, always look for the common diseases. So, kung infectious siya or non-infectious. So, non-infectious, you considered epilepsy, pwede ka complex febrile seizure, especially that you have patient with recurrence of seizure within 24 hours. So, that's complex already, di ba? Tapos after that, the patient was awake. However, you ruled it out kasi
Laboratory.
neurologic deficit, which should not happen in complex febrile seizure kasi normal yan. However, your patient is 18, less than 18 months. So what is very important? Laboratory examination. What is the gold standard in the diagnosis of your meningitis?
Lumbar puncture, Doc.
Lumbar puncture. So that for 18 months, less than 18 months with history of complex febrile seizure, even if the physical no neurologic deficit, we still have to do lumbar puncture to rule out meningitis, ASM. Ha?
Okay po, Doc. This is noted po.
Oh, sige. What ano pat iyo kuan. So
We have
kailangan
also
ka at least may pivot kita, ha? Kung ano gud ang iyo. Sige. Let's proceed.
we have another differential, the bacterial meningitis, positive for nuchal rigidity and positive for Brzezinski's sign. And we have seizure, fever, and the patient is drowsy and cannot be totally ruled out because of the we have need further laboratory workup. And for example,
So what
an
is your
lumbar
diagnosis,
puncture
man? What is your diagnosis?
and bacterial meningococ.
Kaya naman naging ato yan imo differential.
As per amon latest doc nga ano na receptor, as per Doc Nicolas Sora po kasi, differential diagnosis nga da po kayo makuhan amon final.
Yes, Doc.
That's
Tama
how
ba?
we remember po. Yes po.
Di ba't imong differential? Amo yan kuan. Tapos after to amo nimo final diagnosis. Hala sige, okay.
Mapili lang
Bay
kami,
nag
Doc.
bay nag-iba na ada. Sige. What is your final diagnosis?
Bacterial meningitis po, Doc.
Meningitis.
Mhm. Sige. Do you
That's
have
all.
any question regarding your meningitis? You have one CPG for meningitis. Usa ito ka CPG. CPS ng CPG ka ng meningitis. Para sa honito ninyo. So, what is the most common etiologic agent for this age group?
Um,
3 months.
positive, gram-positive bacteria.
Neisseria, Doc.
No.
Ano ba ito?
New,
Nagkuhan na ba ka mang neuro? O infection? Infectious, di ba ini?
ano,
Discuss na ka mo? Or wala ka mamate?
stuff, Doc.
No.
Group B, strep to. Tama ba?
Oh. Group B is for kuan. Let's neonate.
Na yun, ay tama na
Given
yun.
you kuan immunization. Ano tiyat immunization? Ta. Sige. Basahan to niyo kay common ito niya, ha? Always remember to maupay kasi pagbasa ito imo meningitis. It's well documented. Maupay nga ni kung magpapatofisyo ka mo, why do you have nuchal rigidity? Why do you have seizure? Why do you have fever? Why is there drowsy? Kasi if you memorize the pathophysiology, you will be able to explain the signs and symptoms of your patient. And always remember the in your age group, what is the etiologic agent and what is the drug of choice. Tapos, what is your other kuan? What is the drug of choice in bacterial
Ang,
meningitis?
ampicillin and gentamicin, if I remember it right.
No,
Oh,
that is for less than 1 month. For more than 1 month, ano niya? Ceftriaxone.
ceftriaxone. Oh,
Ceftriaxone na tayo,
wrong
ha?
again.
At hindi ka nga ni nakakalaman.
Okay, Doc.
So, it's not only you should kuhan ito imo diagnosis, also read on your diagnosis, ha? Okay, are there any questions?
Doctor, regarding sa differential diagnosis, ah, kailangan nga namon i-categorize into non-infectious or infectious siya.
Depende lang kung may pivot ka mo. Kasi mas maupaya kung may pivot ka. And what's your pivot? Pivot kasi parang namimiling ka kung anong good para you will be able to kuhan hiton imo mga differential, di ba?
Okay po, Doc.
Ikaw nga nito, cardiac, respiratory, in case of mga dyspneic na mga patient, if you are kuhan nga mga cardiac hiya or respiratory or infectious, non-infectious, ikaw la, depende la iyo.
Okay po, Doc.
Okay. So are there any question? Sorry ha, yan na usala kita nga kuan. Usalaan kita kay tinawagan na ako.
Okay. Okay. So, Doc, next meeting po, mag-continuation hand presentation po.
Yes, oo. So no
So,
no
hindi po
kisanay, next
clinics.
na lang naton.
Okay po. Po, Doc.
Tapos hikuan natin niyo leader. Kim? O Alvin.
Yes.
Extend ako na messenger, wala talaga ako maka-receive ha text. Ha?
Sige. Messenger na lang at
Oo. Sige.
attendance ano ako.
Doc, mag-screenshot po for attendance.
Okay. Diyos ko. Sige.
Open cameras. 1, 2, 3. Okay, thank you.
See you next
Thank you
week.
po, Doc.
Thank you,
Sige,
Doc.
Doc.
Thank you, Doc. Thank you, Doc.